So how do you decrease your blood pressure in 1 minute? No, this isn't a video on meditation or just simply trying to relax. This is actually an important topic that a lot of individuals ignore. And this is the issue around choosing the appropriate size of your blood pressure cuff. Now, the reason I wanted to make this video is because, as many of you know, I'm a doctor interested in bodybuilders specifically. And a lot of bodybuilders tend to have arms that are a lot larger than the average individual. And I'll show you in a second why it's important to choose the correct size and why many bodybuilders are choosing the incorrect size. So a reason this is so important is because a lot of bodybuilders tend to use a cuff that is too small for their arm. The issue with this is it tends to give incorrect readings, and a lot of the time it gives readings of blood pressure values that are much higher than they actually are. Okay, not much higher, but can be the difference between being hypertensive or not. The reason it's important to choose the correct size, or specifically correct size of the bladder, is because that's the important part of the blood pressure cuff that is going to occlude the artery which we are measuring. And that's the brachial artery. In order to occlude the artery, if the bladder isn't circumferentially constricting the artery, it's going to incorporate a lot of surrounding tissue and your biceps muscle to try occlude that artery. And the way it does this is by inflating with a lot more air and causing a lot more pressure in order to occlude that artery, because the bladder itself can't occlude it by itself. And this gives you an incorrect reading. So what is the bladder of a blood pressure cuff? Well, I'll show you now. So I hope it shows up on camera. If not, I'll just show images. But essentially, I've inflated it for you. And this is the bladder. So the bladder is this inflated part over here. If you're lucky enough, the blood pressure cuff might actually say what size arm this blood pressure cuff is meant to be used on. And this is for an unflexed, extended arm. So essentially, if the circumference of your arm is between 25 and 34 centimeters, then this is the appropriate cuff for you. With most bodybuilders, this tends to not be the case. Their arm circumference, when extended, tends to be at least above 35, and that's in more advanced bodybuilders. I myself am not a bodybuilder, however, I would need a larger cuff than the one I've shown you. If you're not lucky enough to have a cuff that tells you what circumference of arm it was made for, you can simply test this by looking at the bladder itself, which I showed you previously, and checking to see whether or not the bladder width reaches 40% of your arm circumference, or if the length covers at least 80% of your arm circumference. Now I'll pop up a table which also shows you which arm circumference is correlated to which cuff size, and it's shown here. So I've just shown you 3 methods in which you can tell whether or not your cuff is correct. And again, I just want to reiterate that if the cuff size is incorrect, if it's too large, it's going to lead to incorrect readings, and if it's too small, this tends to increase your blood pressure readings. So there you have it. It's a simple, quick fix to getting an accurate result from your blood pressure machine, and it's a common thing that a lot of bodybuilders specifically, or just larger individuals, tend to neglect. And it's a common thing I've seen with my clients. They tend to be on the larger side, and thus the blood pressure cuff needs to be larger. So I hope you took something away from this quick video, and now you know how to choose the correct blood pressure cuff so we can get accurate readings. Thank you for watching this video. I hope you enjoyed it.